Good morning, everybody, and welcome to our weekly live question and answer series, where I sit with Dr. Ellithorpe and we look to you, the audience, for questions for me to ask on your behalf. And you can do that a couple different ways. Over here in the chat section on the side of YouTube, you will need to be logged into YouTube to see that. You can also email your questions into us anytime during the week. Just make sure the subject line says something about questions for YouTube, and we'll ask those questions on a following session. We're here every Wednesday morning at 9:45 a.m. Pacific. Dr. Ellithorpe does a longer session Monday afternoons at 6 p.m. And so be sure to tune into that as well. If you're here for the first time, welcome. If you're returning, we love to see you guys coming back again and again. Be sure to tell your friends and family about this as well too. We open this up to anyone to ask any and all health-related questions. And of course, we just want to mention that this isn't meant to replace your relationship with your doctor, with your physician. That's very important because they know your full history. They're looking at your lab work. So this isn't intended to be medical advice. This is for education purposes, for us to discuss and learn together. That being said, welcome everyone, and Dr. Ellithorpe, thanks for joining us again today.
Welcome, always a pleasure.
It is. We are getting a couple questions in on the chat already. How about we dive in? Okay, first question is from Robert, and Robert says, here's a joke to start off with. Besides fasting and eating low carb, how do you generate ketones?
I don't know.
You play the piano.
Ketones, you play the piano. Okay, thank you, Robert.
I'm going to be hearing that one a lot, I can tell. Okay, Gary says, an ultrasound shows my gallbladder has sludge and gravel. I have pain in my upper right abdomen. What alternatives are there to surgery? Why do people eat... let's start with that. So what alternatives are there to surgery for gallbladder?
Well, if you have gallbladder sludge and stones, the size matters. So if there's small stones and sludge, it's more likely that that can pass into the bile duct and get lodged. Then that can create a medical emergency of a blocked duct and infection, rupture, sepsis, and even death. So this is not something to play with. This is a serious matter, and I would need to, or your doctor would need to actually see the report, see how that looks, look if there's inflammation already in the lining of your gallbladder. So you should have a general surgeon who is aware of your case and ready to receive you if you have any complications or problems. Since you're already having pain being described, it looks like you should proceed ahead with surgery. People who have a solitary large stone that will never fit into the duct, these are people that are less problematic. They seem to be able to go through life without having to have surgery. Basically, a lot of enzymes, a very low-carb diet, and lots of water and probiotics would probably be the best bet to try and stay well until you meet with your surgeon and address these issues. But there is no alternative miracle gallbladder dissolving program. I will make a statement that the gallbladder and liver flushes that are the olive oil protocol is not to be done. That will aggravate your situation, and I have never seen them work. Never in 40 years I'm aware of that protocol, and it is just not a real way to address it.
Okay, thank you. It's just hocus pocus. All right, why do people eat snails?
Why do people eat snails? That's another joke. I don't know.
Because they don't like fast food.
Because they don't like fast food. They eat snails because they don't like fast food.
When I first read that, I thought it was a serious question, and I'm trying to rack my brain for any health benefits for escargot.
All right.
Okay, good one. Robert says, I just started taking orthomolecular bergamot. What benefits will it have? My ApoB was 145. Do you think it will lower it? So bergamot.
Bergamot is from a plant in Italy or the Crete.
It's a citrus.
Yeah, and it is associated with lowering cholesterol naturally. I don't know if it would lower your ApoB or not. I don't know if I'm concerned about ApoB. In the big paradigm of things, if your triglycerides are around 50 and your HDL is around 50 or higher, so triglycerides and HDL are about the same, it really doesn't matter what your little lipoprotein little a, your ApoB is. This is all minutia. I have never seen over 40 years of practice any really outcome functional impact in the cardiovascular system focusing on trying to address ApoB alone or lipoprotein little a, these little esoteric phenomena. If you get your carbs low, if you take systemic enzymes, drink plenty of water, exercise, but the key is low carb.
Okay.
So bergamot lowers cholesterol. No, there's no clear-cut data on it affecting all the minor players. And I don't think I would focus my attention on that. I would focus it on carbs.
All right, next question says, my friend has ulcerative colitis and was prescribed high doses of prednisone for 6 months, which made him gain a lot of weight. He's on venlafaxine now, and it's the only thing that helps him keep him from having flare-ups, but it doesn't make him feel very good. Do you have any recommendations?
In general, this is a person that we see all the time. And we put them on a protocol, which is a very restricted diet. You've heard me describe this many times before. It's a one menu day where you eat just a protein and a selected vegetable that's of a low carb nature. And you have that for your lunch and your dinner between the hours of noon and 6 p.m. Then you change your menu the next day to a different protein type. Maybe it'll be chicken with a different vegetable. The day before, beef with a vegetable. The third day can be salmon or fish with a vegetable. Fourth day, pork with a vegetable. And you only eat, and that'll take away the stress of the inflammation of the immune system lining your gut, because 80% of it roughly lines your gut. Then we give phospholipids to help repair that phospholipid bilipid layer, and there's only one cell thick. Then we give the SBI Protect, which is an immune kind of enhancing supplement powder mixed with the NT phospholipid powder. And this helps rapidly soothe and heal the lining, along with this very low immunogenic stimulating diet, plus it's low carb. The people tend to heal quickly and very rapidly. So that's what I would suggest.
We see a lot of patients come our way with ulcerative colitis and similar types of GI issues because it is chronic, and it is something that, other than a prescription, patients don't see a lot of relief elsewhere without, well, yes. And there's a lot that we can do with that, but it is a big workup. We're going to look at food sensitivities and allergies and adjust their diet, and then do some targeted nutrition as you're talking about. But certainly that is something that I would recommend following up with a doctor like one of our physicians here.
Yes.
Okay. Next one says, IgG shows moderate sensitive to bromelain. Which enzymes should I take? Digestim has bromelain.
I would say that that's something I wouldn't focus on. You have to have enzymes to disinflame yourself. And bromelain is in pineapple. I wouldn't eat a pineapple per se. But as far as an enzyme, I don't think I would worry at all about that. I have used that test for about 30 plus years now, and I've never seen that to be a problem. So the systemic enzymes, the digestive enzymes, should be used in the manner prescribed. Digestive for when you're eating, systemic for empty stomach to do systemic disinflammation. But I find it interesting, but nevertheless not something that I would focus my attention on. It's such a minor player.
Okay.
Today is the day of minor players. And we've treated so many patients with, ulcerative colitis, gut situations, and we've watched them taper off their steroids and their medications. And I'm talking about people who have been so seriously ill, they've had bowel obstructions from the inflammation repetitiously, and we do this and they're fine.
Okay.
So it's really encouraging.
Another question from Lee says, for Graves' disease, one should not take multivitamin with iodine. Which multivitamin would you recommend?
Well, I don't know that I agree with that statement that you should not take a multivitamin with iodine. It's so minuscule that's in most standard multivitamins. Graves' disease, their theory is that iodine is needed in the function of the thyroid gland. So if you give iodine to someone who is hyperthyroid with Graves' disease in a flare, that this will aggravate it. In practice, I've never seen this over 40 years, never in my life. So I think dietary iodine, and it's essential for life, I think it's very minor. Now, I don't know if I would go with Dr. David Brownstein's high-dose iodine supplementation, but certainly the iodine in a multivitamin is so modest, I wouldn't worry about it.
Right. And most vitamins that I've seen over many, many years don't have any, if not a minuscule amount of iodine in it. Our go-to multivitamins that we stand behind, that we've used for years or researched with.
With Graves' patients. I have many Graves' patients.
Are going to be the TLC Energy Core or orthomolecular's Mitocore. So those are two multivitamins. Neither of those has iodine in them, that to my knowledge. I think
they do, Talon.
You do?
Yeah,
okay.
I think they have a small amount.
It would have to be a very small amount because I see you prescribing iodine on top of those with a lot of patients.
Yes,
okay.
Yeah.
So TLC Energy Core or orthomolecular's Mitocore. All right. How can my friend get off dialysis? What is the first step?
Well, dialysis is usually done for kidney failure, for end-stage kidney disease. And there are, we have an article in the office, I don't know if we've posted it on the blog, maybe you could do that, Blake. There's an article called, what's the name of it? Neurotoxicity of gadolinium. And he's talking about, for all these scans, it's a heavy metal used as a dye. And they're looking at kidneys and their structure. And in it, they talk about, as a nephrologist, using EDTA chelation improves the microcirculation of the kidneys. And he's done 7 or 8 studies where he's published using EDTA chelation has flattened the curve of decline of the kidneys and then seen it improve. So that's called the neurotoxicity of gadolinium. We have a copy of it here. Let's try and post that if we could for the listener. But everything that we do for the gut is going to help every tissue. The kidney is made of the same phospholipids and so forth. So a very low-carb diet, rich in enzymes, a very one menu day, and a restricted eating time, adequate hydration, water, as well as EDTA chelation will greatly improve and gradually improve these people.
Right.
We would adjust the dose. It depends on how bad their creatinine level is as to how much EDTA chelation would be given, but in the hands of an experienced chelation physician, it is able to be done.
Okay. Lee asks, how do you bring down cortisol AM and increase secretory IgA?
Well, it depends on how high the morning cortisol is. Usually up to 25 micrograms per deciliter is normal. So some other labs might have 19, I've seen, but it's supposed to be high in the morning. And in the afternoon, it's supposed to decline. So I would have to say morning and afternoons should be found to determine whether there's an imbalance or not. We use exercise, hydration, good sleep hygiene, good sleep at night. we use dihydroepiandrosterone, DHEA, to really normalize cortisol responses. Natural hormone replacement therapy for men and women. These things help the adrenal glands and the cortisol production. As far as, what was the second part of the question?
Secretary IgA.
Yeah, Secretary IgA. That is an immunoglobulin that's in our saliva and our gut to help protect us, because this is the first entry zone of a lot of the pathogens that come at us every day. And that is really in a product we call mucosagen with lactoferrin in it, and it helps produce and increase secretory IgA. So it's mucosagen will help produce secretory IgA. And then all the healthy dietary things to take the stress off the gut. You'll produce it. We have the genetic code to produce it. What we've done is stressed our immune system with this corruptible marketing of food, fast food, variety of foods, all kinds of different foods, and at lunch, breakfast, lunch, dinner, snacking all the time, late night eating. It's too much on the immune system here.
Good. What's advice for someone with Sjorgen's? How do you say that?
Sargon syndrome.
Sjorgen's
Syndrome.
slash COVID. I have possible lung fibrosis. I have phlegmy cough and struggle to breathe. Best low-carb anti-inflammatory foods. I take proteolytic enzymes, vitamin D, and zinc.
Well, EDTA chelation has always been my mainstay with Sjorgen's syndrome. It improves the microcirculation, which gets the tiny little capillaries all over the body where the fibrosis is occurring, and it helps to disinflame and get those enzymes in deeper with adequate hydration, with a very healthy, low-inflaming diet. So the only other thing I would suggest that they do is maybe consider a glutathione IV and acetylcysteine supplementally with chelation, and they should see improvement.
Okay. And on that note, I'll mention too, anyone that is watching that's a patient here, we wanted to do a little something for our patients to say thank you for the holidays, and we are discounting all of our chelation IVs. So if you come in for a chelation IV anytime for the remainder of the year, you're going to get 20% off of that IV.
Does that also apply to walk-ins?
Yes, any chelation IV.
Good.
Right. Okay. Is immunoglobulin G4 great for someone with Sjorgen's and COVID? I have lymphoma previously and long-standing inflammatory bowel issues.
Well, we're fearfully and wonderfully made in Psalm 29, 139, around verse 28. It talks about, written in the book are my members, known to thee, David in his psalm. Our DNA knows how to do the right thing. So what we need to do is clean the house and clean up the room and let that DNA express itself. And so all these things that we talk about repetitiously work because written in the code of your DNA is the healing that needs to be done. So chelation helps the circulation and the little tiny circulation of the capillaries. The low-carb diet, fasting helps this. High-dose vitamin C helps with the immune system, and enzymes with the cancers. So, yeah, I just want to say if you do that, you should be improved.
Okay. Okay, great. One other thought popped into my mind with Sjorgen's and COVID is we have the, I'm not sure if this would be appropriate, but we have the ozone and blood UBI IV treatment.
Yes, yeah.
For oxygenating tissue.
Right, that's where you infuse in the vein. Well, we take out some blood, and then we use oxygen, ozone, and we inject it into the blood in the bag in a sterile fashion, and you can see it all pink up. Then we re-infuse that, but it goes through an ultraviolet light, A, B, and C, to kill viruses and stuff off, and then it's re-infused back into the body. High-dose vitamin C is also very helpful for that as well. So there's all kinds of wonderful preventive things that can be done. This really should be taught in medical school.
Recommendations for reversing pre-diabetes.
Fasting, low carb, exercise, not eating past 6 o'clock, going to bed on time, using TLC Metabolic Formula. That was designed to really, the medicine metformin. These were based off of the natural berberine, and berberine is in our TLC Metabolic Formula. Alpha-lipoic acid also is very helpful in sugar metabolism, so that will help lower it. So if you would even do, a 7-minute daily routine, and you would drink half your weight in water, and you would eat only 2 meals a day between noon and 6 p.m., and keep it the same, 1 protein, 1 low-carb veggie buttered up, that would be a very low-carb diet. And if you took TLC Metabolic Formula, all these things would be very, very helpful.
Pre-diabetes is very manageable and something that we can absolutely turn around, but you've got to do the work and change your lifestyle and your diet.
Yeah, and they can do it with enough encouragement and love and support. Everything great is done in steps. There's an expression, there's no elevator to success. You have to take the stairs,
right. That's true.
So I would just encourage them.
Okay, Debbie says, can I mix the NT Factor and the SBI Protect with a tiny bit of my protein powder to give it some flavor, or do I need to take them alone? I'd say no, that's fine.
I don't see a problem with it, but if this is designed for healing, I don't know what's in that protein powder.
Right.
And you could maybe have a food reaction to the protein base. Most protein is made, the protein powders are made from like a whey-based casein milk product, or they're made from a soy product,
inflammatory
rice,
based.
and that can be a source of inflammation. So it's kind of a question whether or not it's
right. We have a couple really great medical food type proteins here. I actually really like Zymogen's. I forget what it's called. The
glutagenics?
No. It's it starts with a G.
Glycemic? No. I can't remember the name.
I can't remember. Not glycemic. It's the one that has really, really low carbs, high protein. Anyhow, and they use the New Zealand based whey, which are cows that are not, they're pasture and they're not treated with hormones. But that would be my go-to. And it has a lot of things in it to disinflame your bowel.
But all this stress and time over to make it taste better, to make it taste better, to make it taste better. You know what we have to do is say food is to repair our body, not an entertainment zone every time we open our mouth.
Right.
So we're marketed to always be saying, well, this is fun, and this is fun, and that's fun.
Yep.
No, you know what? Success is that stairway up to health and maintaining it. And so sometimes you just got to bite the bullet and do it.
That's true. Whenever I have to take something that doesn't taste great, I do as little of it as possible in a little bit of water, and I mix it up well. I take it like a shot, and then I'll follow it with some cold water. That's what I do. The other idea that you might try is I really like the taste of the GlutaShield, which is the glutamine. It comes in both a vanilla and a chocolate, and that is great healing for your gut. I mix that a lot. I put my SBI Protect, my NT Factor, and my GlutaShield together in a cup with a little bit of water, and I mix that up and drink it. Okay, coming to the end here. Can I mix NT Factor, SBI, cod liver oil in yogurt, add calcium, magnesium, vitamin C powder?
Well, of course you can do that, but the idea is, what is your situation? What are you trying to fix? And will that make it aggravated? Will it not? It's just too hard to say. Just refer back to everything we said to the prior question.
Right. And then what's the yogurt? Is this yogurt from cows? Is it from sheep? Is it
pasteurized? Is it homogenized? Is it full of sugar for entertainment to taste?
Yeah.
Anything you do over and over and over again that isn't the base essential amino acids, you're going to potentially develop a reactivity to. So you have to be careful.
All right, last two questions here. Is the COVID vaccine thought to cause acquired immune deficiency syndrome because of the constant presence of the spike protein?
Yeah, that's being studied, and there's several papers on this. I have a stacks of paper, many articles. I probably have 15 articles here. Yeah, so you have articles being produced even now regarding the acquired immune deficiency from the spike protein, and it is a concern that, I'm really sad that the federal government, CDC, NIH, FDA, organizations that we once revered and trusted, we no longer trust. Where's all the ongoing weekly safety reports and adverse reaction assessments? You're supposed to dig it out on your own. So the answer to her question is yes. And is it researched? Yes. I don't have the article here. It's in my office. But you have to be cautious. I have some articles here I'd like to bring up. I'm just going to read the titles because we have so little time. But I want you to see how thick this is. See how many pages this is? This is a lot of pages. And you can see on here each page is full, right? Do you see all those full pages? Well, there's the title of this is 310 athlete cardiac arrests, serious issues, 177 dead after the gene therapy injection. And we're talking about anywhere from junior high and high school and athletic teams across the world. This is something that should create questions, and this should be openly discussed by those agencies I just listed. Some good news from Epoch Times. Representative Deanna Harshberger from Tennessee has submitted a bill that hopefully will pass called Natural Immunity is Real Act, okay? Natural Immunity is Real Act. And to complement that, also Senator Mike Lee from Kansas on the Senate side has also introduced Natural Immunity is Real Act. So there's two representatives, one in the Senate, one in the House, that is saying that natural immunity, and there are dozens upon dozens of articles showing, and you remember when I first talking about this a couple of months, 3 months back, the famous Israeli study on the natural immunity is, multiple times superior than any injectable gene therapy. One of the articles is from December 10th last week from Health News. It's talking about natural immunity is more protective over time than COVID-19 vaccine study shows. So that's another article. I have one from Epoch Times called COVID-19 Vaccines Induce Lower Antibodies Against Omicron Variant Study. So this is actually showing that those who had the Omicron have fewer antibodies than those that are natural. This is the study. I went and I looked up that study. It's several pages long, and it shows that, in fact, protection and waning of natural and hybrid COVID-19 immunity is the title of it. This was another article published out of Israel, in which they're pointing out again that the unvaccinated who had COVID, their immunity is superior and more robust and more dynamic. I have another article. There was a FOIA request given to the CDC asking if they have any record of a person with natural immunity transmitting COVID virus, COVID-19. And so this article is, they have no record of anyone with natural immunity transmitting COVID-19. Whereas there are multiple articles of people who have had the injection, having in their nose and mouth the high titer of the viral particles, similar to someone who never had it before and was unvaccinated. So there is no difference in the transmittability between whether you've been vaccinated or not. So I have a more recent report from December 10th. This is from the CDC itself. And here they put out a summary statement on their activities, and they're looking at the Omicron. And basically the summary of the Centers for Disease Control and Prevention on the Omicron, they found that 79% of those that were in the study who had Omicron had 2 doses of the Pfizer. They were looking at a group that had Pfizer. 79% who had the Omicron had the 2 doses, and out of that, 32% also had the booster, whereas 14% who had no vaccine had it. These are all mild symptoms. And of course, then I have the, again, the article based on that from the British Medical Journal, Yale, reduced neutralization of SARS-CoV-2 Omicron variant by post-immunization serum, meaning those who were immunized had lack of ability to neutralize the Omicron variant. Let's see, quite a few studies. So if you want to know what I do on the weekend, it's study. Oh, here's a new study from Brown's University that recommendations to isolate and mask up children is now associated with a 23% decline in children's cognitive abilities. So they're looking at schools. I think about 3-4 months ago I talked about newborns since this year had an IQ drop that was noticed. I don't recall how many points, but I think it was more than 10-point drop in their IQ. Now Brown scientists have been assessing children and finding a 23% decline in their cognitive abilities. So that's a Brown's University study. Yeah, and I got the article from Brown's there as well. So lots of interesting things. It appears that having had COVID provides you a robust and an enduring natural immunity. There is no evidence in the CDC or anywhere that those with natural immunity have ever transmitted this. There is evidently no real protection from the gene therapy injections to preventing getting the Omicron. Fortunately, Omicron variant is probably much more mild. In fact, the health minister of South Africa, where it was first seen about 3.5 weeks ago, is actually talking in terms that she's surprised, she's upset that the Western world is acting so hysterical, and she actually used the word hysterical over this. There really have been no deaths. The one reported from England yesterday is saying there was a death, but they said with Omicron, not from Omicron.
Right.
So I want to give hope and excitement to see that there's some Senate and some House bills, standing up for natural immunity and for the great immune systems that we have. I would say we should be seeing reports on this. We should be seeing if it's a disease prevention center, then why aren't they talking about D? Why aren't they talking about a low-carb diet? Why aren't they talking about the sleep, importance of a good night's sleep and exercise in the immune system and your T cells, and the value of quercetin, the value of vitamin C? So it's very perplexing, but thank goodness there's doctors out there that have done early and therapeutical prevention as well as treatment. So I'm not worried at all. We've had no problem here.
We've done great with our patients.
We've had no deaths and no hospitalizations for 2 years.
I do need to wrap up because it's getting close to your first patient of the morning. Hey, before you go, just take one quick second, and if you enjoyed this content, please do us a favor and hit that like button. That helps get this message out and spread the word. We will be back, and I noticed there's a couple questions at the end that we didn't have time to get to. One about, what papers did she mention? Dr. E files all these away. It's not always easy for us to share the links to all of them, but if you go back in the video, she mentions the source and the name of it, so you can Google it right now if you like as well too. But we will make sure to get these questions that were not answered on our next session when I'm here Wednesday with Dr. Ellithorpe. Thank you so much for joining us. We look forward to having you again back on our next session, Monday at 6 p.m. and then Wednesday at 9:45 a.m. Tell your friends, tell your loved ones. We're here to answer questions, and we look forward to serving you then. Thank you so much.
God bless.